So hello, everyone. Welcome to Lupus You, Answers, Advocacy, Action. My name is Ashley Holden, and I will be your host. Tonight's program will focus on lupus and the skin. We would like to thank our presenting sponsor, Mallinckrodt Pharmaceuticals. Before we begin, I have a few housekeeping items to go over. If at any time you have a general question that you would like to submit to our speakers, you can send it through the Q&A function at the bottom of your screen. Just click on it and type in your question. If you would like to submit your question without providing your name, there's an anonymous option available to you that you can select during the submission. We will have time allotted at the end where our speakers will answer submitted questions from the audience. If you have a question that is more specific, you can reach out to our health education specialists at lupus.org/healtheducator. Tonight, we will also have opportunities for you to interact with us and each other. Throughout the program, we will have polls that you can respond to, and you can also connect with each other by using the chat feature. And I see so many people already using that chat feature tonight, and that's wonderful. And finally, I want to let you know that this program will be recorded. You will receive a link of the recording along with helpful resources and a post-event survey where you can submit feedback about tonight's program. So we can go ahead and move to the next slide. And that's our first poll of the evening. And so our first poll question is, what time zone are you in? And I'll give us about 30 seconds to answer this. So again, those choices are going to be Eastern time zone, Central time zone, Mountain time zone, Pacific time zone, or other. And we'll give us about 10 more seconds to answer that. Great. We'll go ahead and end that poll. And it looks like the majority of us joining this evening are from the Eastern time zone, but we have a mix from all of the different time zones, as well as people from outside of those time zones. So we have a great variety of people joining us this evening. So this is an overview of our program. I will be sharing more about the Lupus Foundation of America, some helpful resources and ways that you can get involved. We also have Dr. Hernandez joining us tonight, and she will be discussing lupus and the skin. And then we have Dr. Ho, who is going to share more about ways how you can protect your skin while living with lupus. We'll then have a moment of motivation with our very special guest, Maurissa Tancharoen Whedon. And then finally, you will have that opportunity to interact with all of our speakers during the Q&A session. And with that, we can move to the next slide. So as I stated earlier, I will now be sharing more about the Lupus Foundation of America, some resources and opportunities for you to get involved. People affected by lupus represent the heart and soul of our foundation. You are the central focus of everything we do and are a constant reminder of our mission's urgency and serve to motivate us to continue this fight. We understand the emotional turmoil, economic hardships, and physical suffering caused by lupus. Because of you, we are motivated to work harder and faster to bring lupus under control so everyone can have a life free from lupus. To put this simply, our goal at the Lupus Foundation of America is to one day end the impact of lupus and its suffering, while ensuring that we provide the comprehensive support and programs people with lupus need today. Our programs stand upon three pillars: research, care and support services, and advocacy. We have redefined lupus research to expand our efforts beyond just funding lupus research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this while providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. So our research is patient-centered and focused on transforming lives. We have 3 goals: identify the causes of lupus, discover better ways to control symptoms, and ultimately find pathways to cure lupus. To do this, we must attack lupus from every direction through advocating for sustained lupus research funding, directly funding research that impacts people's lives, and bringing together lupus experts from different areas. Here are just a few examples of how by working together, we've made a difference. We established the first National Childhood Lupus Research Program, successfully advocated for $615 million for lupus research, and invested nearly $4 million in a promising research study for stem cells as a potential treatment for lupus. By working together, we are bringing us closer to our vision of a life free from lupus. Next slide. So people with lupus are so important to the research process, and that's why we've developed our new online research platform called RAY, Lupus Research Accelerated by You. We've made significant progress in our lupus research, but we are far from our quest to solve this cruel mystery. And researchers need your help. You can help advance lupus research right from the comfort of your home by participating in RAY. Share your experiences with lupus to help inform future clinical trials of new lupus treatments and identify the most pressing needs of people with lupus. No one understands lupus better than those living with it. With RAY, you can compare your experiences with others, get updates on new research studies, share medication and health information with your doctor, and help brighten the future of lupus research. I would like to shift gears and share more about our programs and resources. So to start, we have our National Resource Center on Lupus, and that is your one-stop resource for all things lupus, from treatment to living and coping with disease. It aims to ensure that anyone affected by lupus, including people diagnosed with lupus, caregivers, and healthcare professionals, all have access to high-quality resources that provide emotional support and clear, accurate health information. We also have certified health education specialists. Our health education specialists are trained to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information to answer your questions about lupus and how to cope with it. To contact a health educator, you can fill out our online form at lupus.org/health educator, or they're also available by phone. And that phone number is 1-800-558-0121, extension 136. We also have Take Charge, a 12-week education email series for people with lupus, including those who were recently diagnosed. When you sign up, you'll get an email from our health education specialists with tips and resources that can empower you to take charge of your health. The series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most out of your doctor's appointments, just to name a few. We have so many other programs and resources available to you. Some of those include the Expert Series, which is our monthly educational podcast where our team interviews experts in the field about topics that are important to you. We have more than 150 support groups across the country where people with lupus can come together, ask questions, and listen to others. And we also have Lupus Connect. So you can join Lupus Connect, our online support community, where members can engage with each other and ask questions. There are also so many different ways that you can get involved and support the fight to end lupus. One way is through Walk to End Lupus Now. So many of you have participated in one of our many walks across the country. And this year we'll be walking virtually again. And our walk this year will be on October 16th, 2021. There's Make Your Mark, which is our community fundraising program, a way to turn an event into a fundraiser for lupus. Use your passion to raise funds for lupus through an in-person event, a virtual event, whatever you may think that could be a great fundraising opportunity. And finally, your voice is one of the most powerful tools we have. We are the leader in stimulating federal support for lupus, generating more than $615 million for lupus research and education in the past 5 years. Every day we fight to ensure the government is responsive to the needs of the 1.5 million Americans living with lupus. So don't forget, you can visit our website and sign up to be a lupus advocate. You can find local support and connect with resources in your community through our network of chapters and regional offices that offer local programming, support, and events. To learn more about your local chapter, you can visit lupus.org/chapters. And finally, here is more information on how you can reach out to us and also follow us on social media, which is a great way to stay updated on all of the programs, events, and services that I've mentioned tonight. Great, so it's time for our next poll. And this poll question is, have you ever experienced any lupus-related skin problems? And the options are yes, no, or I am not sure. Please keep in mind that this poll will be anonymous. We'll go ahead and give us about 15 to 20 more seconds to respond to this, and then we'll close the poll. Okay, so it looks like we have a good amount of results in, and about 83% yes, they've experienced skin problems, 5% said no, and 12% said they're not sure. Thank you all for participating. So with that, I'd like to introduce our first speaker, and our first speaker will be Dr. Hernandez. She is an internist and rheumatologist who has made wonderful contributions to the efforts in treating lupus. Dr. Hernandez serves as Executive Director of ACAR Immunology for Mallinckrodt Pharmaceuticals, and Dr. Hernandez is based in New York. Today, she will be discussing lupus in the skin. Thank you for being here, Dr. Hernandez. The floor is yours.
Thank you. It's a pleasure to be here tonight. Thank you very much for the invitation. I'll be briefly discussing tonight what happens to the skin in lupus and the relevance of the UV light, not only directly for the skin, but its relationship with the disease in general. So to get this conversation started, let's discuss a little bit about UV light. UV radiation is a form of electromagnetic radiation that comes mainly from the sun, and it refers to waves. These waves propagate through space, and they carry with them radiant energy. To give you a little bit of context, these waves receive different names, and you'll see that, in fact, we are all already pretty familiar with them. In order of increasing frequency and decreasing wavelength, let me tell you the names of these waves. These are radio waves, microwaves, infrared radiation, visible light, ultraviolet radiation, right there, X-rays, and gamma rays. So right there in the middle of this spectrum is the UV radiation or the UV light. UV light is classified into UVA, B, and C. And while UVA and UVB rays differ on how they affect skin, they both can cause health hazard. So here you see in blue, the UVA rays have the least energy and cause skin cells to age and some indirect damage to cells' DNA. They are mainly linked to long-term damage of the skin, such as wrinkles, certain skin cancers. UVB rays have slightly more energy than the previous ones. They can damage the DNA in skin cells directly, and they cause sunburns and cancers. Now, exposure to both of these triggers a wide, complex range of intracellular processes. These sophisticated processes result in a few things: cell damage, repair or certain levels of repair of cell damage, death, and inflammation. The general outcome varies. It's dependent on the duration of the exposure, the intensity of such exposure, and the patient, him or herself. Long story short, it is very important to avoid exposure, and we'll talk a little bit more about that in a second. The best way to protect the skin will be better described by Dr. Ho in a few minutes, but please note that very often homemade protections are not useful. Oils, cold cream, honey, some other things we find at home are not really useful. We'll see in a little bit, in a second, more useful ways of get the protection we need. And please, at all times, be mindful of the time of exposure to UV light during the day. It's amazing at the end of the day how easy it is to lose track of the time we've been out there exposed. So more details on the next slide. Could you go to the next one, please? So exposure to UV light. This meeting is really oriented to remind you all that aberrant responses to UV light frequently lead to the formation of skin lesions and activation of systemic inflammation in lupus in general. As you can see here, stay in the shade, cover your skin, use a white hat like a sun hat, use sunglasses, and above all, wear sunscreen all year long. Many people believe that the UV rays on tanning beds are harmless. This is not true. Be careful with those. Also, there's people who may be exposed to artificial sources of UV at their jobs, so they should follow appropriate protections and precautions. And as I said before, please be mindful of how often you step outside. Keep a bottle of sunscreen handy at all times. And in general, I think the best recommendation is just to be aware. Outdoor activities such as sports, outdoor work, spending time near windows at home or in the office, even inside the car, running errands, standing in a line, this all adds up at the end of the day, and they all represent a very clear and defined risk. Just a comment: when we take good care of UV light and we block the exposure to it, vitamin D levels may drop. This is not the end of the world. It's easy to fix by adding a supplementary dose of vitamin D if and when needed. But the main idea here that I want to share tonight is that we have to be really very aware of all the time that we are exposed to UV light. Next slide, please. Thank you. A few words regarding photosensitivity. So the response to UV light is distorted in patients with autoimmune diseases like lupus. UV light leads to the formation and activation of systemic inflammation. The mechanisms driving UVA and UVB to be disruptive and to cause immunosuppression in the skin are complex. They include many pathways and cascades that get all activated in parallel. But to give you an idea, when DNA absorbs UVB, it disorganizes. Everything turns a bit chaotic. Protein and lipids are damaged, resulting in the modulation of cellular signaling pathways and membrane structures. And this modulation is often like not the best. It gets disorganized. Then the cell death process also gets altered. You know, cells are supposed to follow a process, an organized death, a programmed death. And often with UV light, there's a lot of, let's say, confusion at this level. And the cell death process is impacted, is disorganized. Even the process of disposing of those dead cells is affected. And this brings a lot of consequences that we don't need or want. There's antibodies formation, then there's further deposition of those antibodies at the dermal-epidermal junction, and all of this can be induced and worsened by the UV. So the UV also produces different inflammatory substances that contribute to perpetuate this situation. This, by the way, it's not only these substances, also the cells themselves, that the cells that are part of the immune response are altered. Think of them like the first responders. When there's damage, all the organization of this response, it's disorganized. Lupus, as you know very, very well, is chronic, is inflammatory by nature, and is an autoimmune disease that has cutaneous involvement. Whereas systemic lupus generally involves multiple organs and systems, cutaneous lupus affects skin and mucosa and can be further classified into a couple of subtypes. Could we have the next one, please? Thank you. So cutaneous lupus is a broad spectrum, includes a broad spectrum, as I said, of subtypes, divisions to understand it better, based mainly on its duration. So these include acute, subacute, chronic, and intermittent. Chronic can be further classified into several subclasses, and I will let the expert explain this in a couple of minutes. But the most common one would be the discoid lupus. Now, signs and symptoms of these cutaneous affections of cutaneous lupus can include itch, scale, photosensitivity itself, this wrong response to UV light, erythema, alopecia, scar, and fatigue. Fatigue usually is there all the time, as you know best. The patient that has cutaneous lupus should be evaluated for systemic lupus as well. He or she should be thoroughly explored and assessed. Other things that you can find, that you can see also on the slide, is, well, the hair loss. It's a common problem. There is typically short hair right at the frontal hairline, and hair thinning in general, mucosal ulcers, as you can see there, sores on the scalp as well that complicate further the hair falling out. And also, patients with lupus can have problems with blood or blood vessels. And although this is not a skin problem, you can see it on the skin. A the most common ones are shown there in blue. Of course, Dr. Ho, who's an expert in all of this, will clarify further. The next one, please. So just a few pictures. I just really want to wrap up by just highlighting a couple of things. The importance of being aware of the disease, aware of following the doctor's orders and being compliant with the treatment, aware of the light when we are outdoors or even indoors, the time of the day, the amount of time that we've been exposed. And here are just a few examples of the most typical lesions that we can find. The next one, please. So we know that cutaneous lupus is cause of concern for the patient, of course. There are many different aspects involved and or touched by cutaneous lupus. The clinical assessment of the disease activity is fundamental. Remission in lupus is the goal, and there is reason to be optimistic as long as the patient takes general measures of protections and adheres to medication. The prognosis of lupus, please keep in mind, is better today than ever before. Thank you very much for this space. And now, please take our poll.
Thank you so much for that great information, Dr. Hernandez. We are so lucky to have you join us this evening. So before we go to our next presenter, we do have another poll question. We'll give that a second to pop up. So the next poll question is, what are some ways you can protect your skin? And the options are: use sunscreen, wear protective clothing, avoid outdoor activity during peak hours, or all of the above. And again, I will give us about 20 more seconds to answer that. Okay, so it looks like we have the majority of the answers in the poll. So I promise this wasn't meant to be a trick question. The answer is that all of these options are great ways to protect your skin. And we'll learn more about this during Dr. Ho's presentation. So next we have Dr. Byron Ho. He is a board certified dermatologist specializing in medical, pediatric, and cosmetic dermatological services. He is also an attending physician and clinical associate at the Johns Hopkins Department of Dermatology, as well as a member of the American Academy of Dermatology. Thank you for joining us tonight. Dr. Ho, you may turn your camera on and unmute yourself and begin when you're ready.
Hi, everybody. Thanks for joining us today, and thank you for giving me the time to talk about this important topic and hopefully give some good information out. So we can get started, please. So the basic overview of what I'll be going over today, we'll talk about some of the most common forms of sun-sensitive skin lupus. There are many types of skin lupus, and it can get quite granular. But we'll talk about kind of the most common things and the ones that you can protect yourself from. We'll talk about some of our common topical treatments for skin lupus, and then we'll talk about good like preventive habits and behaviors, things that you can do at home and every day. Next slide, please. So the first type of skin lupus that we'll talk about, that Dr. Hernandez also kind of touched upon. So this is the classic type of skin lupus. When people think about skin lupus, they often think of that butterfly rash of the cheeks, of all that redness and swelling, kind of spares the skin fold that connects the nose to the corner of the mouth. This is called acute cutaneous lupus. Acute because it often happens quite quickly, within a couple of days, many times from kind of intense sun exposure. It does not have to be only on the face, even though that's the one that we think of the most. So it can be on other parts of the body, but typically in parts of the body that have also been exposed to sunlight or UV radiation. This was probably the most sun sensitive of the different types of skin lupus, and also the most kind of commonly seen form of skin lupus that triggers us to look for and think about the activity of having lupus inside the body or systemic lupus. Not everyone with either systemic lupus or lupus in general gets this type of lupus. There's kind of like a wide range of things people can get. This is one of the most common ones, and the most common one that we see with systemic lupus. Next slide, please. The next form of skin lupus that we see quite often that is also very sun sensitive is called subacutecutaneous lupus. The kind of timelines of this, they were classified based on like the chronicity and timeline of when many patients had them. These kind of rashes and lesions often linger for several weeks, sometimes even months. Whereas the last one that we talked about tends to be like quite swollen, but if you ran your finger across it, you might not feel that much scale or flaking to it. With subacute cutaneous lupus, one of the hallmarks is quite a large amount of scale, especially around the edge of the rashes. You often see these circles or rings of the rash. And again, often in areas, usually in areas that have been exposed to sun. This one can be on the face, but we often see kind of like some of the most activity on like the upper arms, upper back, kind of like torso area, chest as well. When we see this type of lupus, we also think about whether or not somebody might have lupus inside the body, internal systemic lupus. In some studies, up to 50% of people with this form of skin lupus will find it inside the body as well. It can be more of a mild form of internal systemic lupus that we find, but certainly it triggers us to look and kind of check all the organs and treat it if we find it. Next slide, please. And then the third form of skin lupus that I'll kind of touch upon tonight is called discoid lupus. So with this type of skin lupus, the risk of having systemic lupus, which would be lupus inside the body affecting other organs, is much lower. It can still happen, but only about 10 to 15% of patients with discoid lupus will go on to have lupus inside the body. So many of these patients are often really only seeing us in dermatology sometimes to help them kind of keep control of their skin and symptoms. So discoid lupus is kind of quite different from the other two that we talked about, in that with this form of lupus, the kind of rash and lesions can last quite a long time, sometimes months. It's one of the forms of chronic skin lupus that Dr. Hernandez mentioned. It does have a very high risk of scarring. So in terms of, since again, sun sensitive, sun exposed areas are often like very kind of cosmetically sensitive areas, you know, like our face, our hair, our scalp. And so when scarring occurs from discoid lupus, it can be quite noticeable and extremely distressing for patients, not to mention like very itchy or painful or tender. And when it's in the scalp, discoid lupus can cause hair loss. And sometimes when that hair loss starts occurring, it starts to scar very quickly. And the hair loss can be fairly permanent if not treated quickly. So this is one of the reasons to kind of pay close attention to areas of, you know, when you have rash on areas that are hair bearing, because, you know, if it's discoid lupus and we treat it quickly, we can preserve a lot of that hair. It's very hard to get back once it has started to scar. Also with discoid lupus, because of the scarring, when that happens, the scarring affects the pigment making cells, the melanocytes. And so people lose pigment in those areas. You get these white patches and Next slide, please. All right, so in terms of skin-directed therapy, the first thing that we often do would be topical steroids. So in dermatology, we have very many topical steroids that we use. We have a whole host of things, and we're like extremely comfortable using them. Typically, with topical steroids, we prescribe them as twice per day. I like to give people ointment-based topicals, which are much more greasy. So ointments are in a Vaseline base. They work much better. So even though Vaselines, are goopy and greasy, can be kind of messy, it keeps the medicine on the skin better, and it's much more effective than using creams or lotions. The more inflamed something is, the stronger the topical steroid you need to get the medicine in there and get all the inflammation down. Certainly, many patients and many people have, they hear steroids and quite reasonably so become worried about side effects. Is the steroids going to affect my hormones? Does it get into the body? I'm here to tell you and reassure you that with topical use on the skin, pretty much none of it gets into the blood and inside the body to affect the body. I like to put on my prescriptions twice a day, Monday through Friday. That Monday through Friday is always just a reminder to people to take 1 or 2 days off a week. And even with that regimen, someone's using it twice a day, 5 days out of the week. It is extremely safe to use topical steroids for months on end that way, as long as you're using it on your active rash and active spots. Next slide, please. So here I just wanted to give a few examples that I'm sure probably many of you may have heard of these ones. You might have some at home. These are some of the common topical steroids that we'll use. And this is just to give you a sense that they're all kind of different. And we use them in different ways. We have kind of different purposes for them. And we're treating different body areas for them. So starting on the left-hand side would be clobetasol. So that is an extremely common example of a very strong topical steroid that is used like pretty much in all regions around the US. This one is very good for kind of like quick, intense flares of lupus, very good for discoid lupus, where you do need something strong to prevent the scarring from progressing and get on top of the inflammation quickly. And this one we use very much like in the scalp, sometimes on the ears, hands and feet. And then when it's like quite an intense flare, we'll use it on like the arms, legs, and body as well. In the middle, you'll see triamcinolone there. That one is very nice because it's one of the few that comes in a big tub. So for people who have a lot of active disease and a lot of lupus like all over their body, it is much easier to use your steroid in a tub and just slather it on than try to squeeze out a little bit at a time out of a tube and try to cover the whole area. It's also nice because it's a middle strength topical steroid. So very good to use on the arms, legs, and body. Occasionally we'll use it on the face, like for example, for discoid lupus for, a week, a few days at a time. But very useful for people and very like practical and kind of user-friendly. And then on the right-hand side, we have hydrocortisone, another very commonly used topical steroid. This is a much gentler one, kind of lower strength. Not going to be very good for stuff on the hands or feet, but very helpful when patients are dealing with rash or lupus, like on the face, groin, or other like sensitive body fold areas. Next slide, please. And then one more topical to mention that many of you may have heard of or used before, topical tacrolimus ointment. So this is a non-steroid anti-inflammatory. So especially for our patients who are using topicals pretty consistently and do need to use it kind of all week long to keep their skin under control. Remember I said I like to tell people steroids about 5 days a week. So then on those 2 other days, you could use topical tacrolimus, for example, which is a nice non-steroid anti-inflammatory. It's not that strong, so it's not very good kind of like on its own or for like kind of quick, intense flares, but it is very good to use still kind of in between on the days off between the topical steroids so that the skin is getting something to get the inflammation down and keep it under control. One thing to know about this, in case any of you have it or might have it in the future, if nobody has told you before, tacrolimus can cause stinging when you use it, especially when you put it on skin that's very inflamed. This is very normal. It doesn't mean you're allergic to the medicine. It's like a known effect of the medicine. Keeping it in the refrigerator can help make it much more comfortable to put on if you put it on cold. So that's a little tip for you all. Next slide, please. All right, so now we'll transition into kind of like some preventive things and things that you can do so that you don't need to use your topicals all the time. So why use the sun protection? For people who have both skin lupus and then internal lupus, systemic lupus, sometimes when the skin lupus flares, the internal lupus flares too. So protecting the skin from kind of intense UV exposure, from sun exposure and from flares can help keep kind of like protect all the other organs, you know, if you do have lupus affecting things inside the body, for example, like the kidneys. Unfortunately, you know, if chronic untreated skin lupus, especially with discoid lupus, you know, sometimes it's not itchy for people and sometimes people doesn't matter to them what it looks like. Maybe it's on a body area that like they don't see and don't mind. The reason to still treat it though is that chronic inflammation, if left uncontrolled and you just kind of let it be inflamed for years and years, it actually does put people at risk for developing skin cancer there. And that's solely because of that uncontrolled chronic inflammation and damage to the skin cells. So we do like to have, you know, help people get as much control as possible. And then a lot of patients, especially with kind of more severe lupus, the medicines that they get, you know, that you need to keep your lupus under control, many of them, not all, but many of them are immunosuppressing. And we know that patients that need medicines to suppress and calm their immune systems down, the immune system's always looking for cancers and skin cancers. And so the risk of skin cancer can go up with long-term immunosuppression. Next slide, please. So number one is sunscreen, definitely. As much as we tell people, you know, stay inside, avoid the sun, you got to live your life, you know, but going to and from the car, in and out of the house to run errands, that's enough UV exposure over time to keep that lupus inflammation going. So when you're looking for sunscreens, you're looking for things that say broad spectrum. That's pretty much everything on the US market these days. But broad spectrum basically means that it covers UVA and UVB that Dr. Hernandez talked about. You won't see anything that's really marketed for UVC, even though, as Dr. Hernandez says, that's the strongest UV. Not enough of it gets through the atmosphere that it's as meaningful for us. So the companies just don't really test against UVC, in case you were wondering. We like the physical blockers more than the chemical sunscreens. So when we say physical blocker, we're talking about titanium dioxide or zinc oxide. So these are minerals, and the way that they work is that they actually reflect the UV light off of your skin. So they reflect all of it. It's by definition, it's going to be broad spectrum. Whereas chemical sunscreens work by absorbing the UV. And so the different brands and products use different mixes of chemicals to try to cover the spectrum. But if you get a mineral or a physical blocker sunscreen, you know it's just working, just reflecting all of it. I put a couple examples here of some products that a lot of people like. You do, especially for our patients that are kind of like the most sun sensitive, definitely SPF of 100 or more. You may have heard before like, oh, SPF more than 50 doesn't really matter. In this case, that's not quite true. We know nobody puts on a thick enough layer of sunscreen to actually reach the SPF rating. So even though in the lab, you know, this product you see here, Neutrogena, it's 100 plus, the way people use it and put on a thin layer because they don't want to look pasty, it's a lot less than that. I don't know, maybe like 70 or 50, certainly not 100. So actually the higher SPF you use, since none of us put on enough, you get more protection, especially if you know your skin flares. Reapplying every 2 hours, especially with, you know, during outdoor activities is very helpful. Reapplying with sweating and after getting wet, swimming, that is helpful also. Unfortunately, for our patients with more brown skin tones, it can be very hard to find high SPF sunscreens with a brown tint. I put one example here, the Elta MD tinted product here. So tinted really just means that the sunscreen itself is brown. So when you use it, it's not white, it's not pasty, it's a lot less obvious. It can be more kind of aesthetically and cosmetically acceptable for people. I haven't yet really found a kind of more cost-effective or cost-friendly high SPF one. So if anybody has one, I would love to hear suggestions. Some of those can be quite expensive. So the Elta MD one here, the SPF, unfortunately only 44, is one of the kind of few products that I've found that is tinted and at least, a mineral and protective. Next slide, please. All right, and then finally, a few other tips other than sunscreens. You'll also see a lot of just moisturizers and lotions that market themselves as having SPF. That's great probably for the kind of general population, but for people with very sun-sensitive rashes and lupus, those SPFs are never high enough. So welcome to use them, but you should still probably put on a good layer of mineral sunscreen afterwards. We've mentioned a little bit about protective clothing. So you can look for clothing that has a UPF rating. So that's kind of like the SPF, except for clothing. And you're looking for something 50 plus. You don't have to buy special UV protective clothing. Long sleeves and pants, kind of hopefully weather and activity permitting, but those things will be helpful. Gloves if you can, and again, sunglasses if you can. Wide brimmed hats, so not just baseball caps, but something with a brim all the way around that covers the shoulders and the neck can be quite helpful. Peak sun hours are typically 10 a.m. to 4 p.m. depending on the season and where you live, but certainly trying to avoid as much outdoor activity in those hours is helpful. And even staying away from windows. So pretty much no normal windows out there will protect from UV rays. Your car window doesn't unless you have a especially UV tinted one. So for our patients who are extremely sun sensitive, you can discuss a medical letter for tinted windows with your doctor. And we have had success kind of getting that approved legally for people to get to their cars. And I think that's it. So thank you very much for having me, and I'll look forward to questions later on.
Great. Thank you so much, Dr. Ho. That was so informative. We can go to the next slide. So now we would like to welcome tonight's special guest, Maurissa Tancharoen Whedon. Maurissa has been a lupus warrior since her teens. She is a writer, producer, and actor. Most recently, she was executive producer on Marvel's Agents of S.H.I.E.L.D. She has also been a long-time supporter of the organization, raising awareness and funds to support the foundation's research and education programs. She's going to share with you a little bit about her journey and experience with skin lupus. Maurissa, when you're ready, please feel free to turn your camera on.
Hi, everyone. I'm Maurissa Tancharoen Whedon. I am so happy to be here to share my story with you. Firstly, I want to thank Dr. Hernandez and Dr. Ho for sharing their expertise and all that vital information pertaining to lupus in the skin. It's because of incredible doctors like them and their advice that I've been able to navigate living for a very long time with lupus. So I guess I'll start from the beginning. I was diagnosed with lupus at 15, so pretty early on. And over the years, it's run the gamut on me. I've had flares of the lungs, central nervous system, kidneys twice. I now live with chronic kidney disease, lupus nephritis, which has now turned into chronic kidney disease. But the first presenting symptoms when I was 15 was flares of the skin. So I had the classic malar rash or the butterfly rash across the face. I had several lesions on the back of the arms, the hands, and along the legs. And I think that the toughest part about that, especially being so young, was not only the discomfort, but just being so self-conscious about it. And, you know, when you're at that age, you're already sort of full of insecurities. You're trying to find your place in the world and figure out who you are. And to look in the mirror every day and see that rash. And, you know, during the summertime when everyone was going to the beach, and I wanted to be summertime cute too, in a tank top and shorts, I had the rashes covering my skin. So I think the emotional toll is also a part of it. And I want to talk you through that and talk to you about how I overcame that and the steps I took to help my skin calm down. Much of what the doctors are talking about is exactly what I did over the years. It took me a lot of time to come to terms that I had to adhere to doctors' advice about staying out of the sun, wearing very high SPF sunscreen, taking not only oral steroids, but, you know, being diligent about putting on the topical steroids. I think as I grew up, I became more inclined to follow their advice. And I think I should share with you that at the time, lupus awareness wasn't as prevalent as it was now. So it took a very long time to diagnose me and actually discover that I had lupus. I went to a dermatologist first. This was in the early 90s. And after several biopsies of the skin, the theory sort of was that it was an allergic reaction to mosquito bites, because I had always been allergic to mosquito bites. But then it seemed more tricky than that. And finally, I started developing extreme fatigue and tons of joint pain. And I also had severe hair loss. And with all those symptoms, I was finally sent to a rheumatologist. It's been a very long journey. I think, you know, there's a lot to say about it. And the main part is just sort of relishing the good days and being grateful for the good days. But it does take a lot of responsibility on your part. Still to this day, even though my skin has calmed down, I live with other flares of lupus. I'm still on an assortment of medications just on a daily basis to maintain my symptoms, you know, in a manageable state. I've never really been in remission. My lupus is quite volatile when I flare up. So I do whatever I can to manage the disease. And so paired along with my medications, I take various vitamin supplements. I also have adjusted my diet. I found that eating less inflammatory foods also helped to sort of quell my flares, especially pertaining to the skin. I found that when I ate more spicy foods or nightshade vegetables, it would flare my skin. Now that's what I've discovered from my personal experience. I'm not sure that translates to everybody. I've also discovered that incorporating a daily practice of meditation, it's so stress related. I will say that when I was 15, I had a very unusual childhood. I was in, this is very strange, but I was in a pop group and I was touring the country. And so I was traveling a ton and not getting a lot of sleep. And that's a lot of stress on a kid at the age of 15. And so with all the travel and lack of sleep, it's no wonder that my body was sort of at its peak and set into overdrive. And, you know, a lot of the initial skin flares were attributed to the stress and perhaps an allergic reaction. But then, of course, we later discovered I had lupus. But I say that just to sort of emphasize that if you can find a moment in your day to just center yourself and ground yourself and just have a couple moments of peace and deep breathing, that is very, very helpful for your overall well-being. I'm not sure what else to say. I would say wear your sunscreen, avoid the sun. I still wear hats to this day, even if it's overcast outside, even in the cooler months, I still wear a big brimmed hat. When I'm driving, I have a hat on. Sometimes I occasionally even sport the driving gloves. And because I've had several flares of the skin where I've had lesions on my palms and both the front and the back of the palms. So you just do what you can, listen to your doctors. And, living with a chronic illness is not at all easy. And when you're diagnosed with lupus, you're suddenly aware of your fragility and your mortality, and you're aware of it in a way that you have never had to consider before. And at times that can be very daunting, and you're forced to prioritize your health and well-being. And I guess sometimes I've felt that becomes a burden, but if you could just look at that as a gift, because you now have a heightened awareness of what matters. And what matters is being present and being loved and being alive. And that's what I'd like to share with you. Thank you so much for having me.
Thank you, Maurissa, so much for sharing your story. I know that it resonates with so many people that are attending this evening. I see people commenting in the chat. So we just really appreciate you sharing that. And I know it's touching so many people.
Thank you. Thank you for having me.
Of course. So now we would like to invite all of our speakers back for our question and answer panel, where we can answer the submitted questions from the audience. You can still submit your questions for the speakers through the question and answer function at the bottom of your screen. We'll try to get to as many as possible. I know I already have a start of a list here, but we'll go ahead and I'll give you guys just a few seconds and we'll go ahead and get to those questions. All right, do we have everybody? So the first question that I happened to see was maybe Dr. Hernandez, you could answer this one. Should lupus patients be concerned about the UV lamps used in nail salons, such as the ones they use for gel nails?
You broke up a little bit. About what used in salon, sorry?
Should lupus patients be concerned about the UV lamps that are used in nail salons for like gel nails?
Oh, the ones I guess they use to dry your nails.
Right, or to cure them?
It's a very short period of time, so I wouldn't think so, but I don't know if Dr. Hoss, if you have a different explanation or information. Those machines where you put your nails for a little while to get the polish dry.
I would think they could make it worse, but the skin around nails is pretty tough. So someone with lupus might tolerate it just fine and not get a flare to it. But if there's UV coming out of it, in theory, yes, it could cause a flare.
Very interesting. Thank you. Maurissa, I have one for you. And so this one is, based on your experience, what would you recommend someone looks for in a dermatologist to make sure that they hear your concerns and take things seriously from a patient perspective?
I found a dermatologist who I actually asked my rheumatologist to refer me to someone who has had experience with other lupus patients, just so that they are sensitive and aware of the things that I, as a patient, may experience that is different from just, a person who is at normal health. And I found that to be very helpful in all, basically in all my doctors that I see, because I have to see an assortment because I have many, many ailments. I make sure that they have, or I am sent and referred to people who have an expertise in patients with lupus.
Great, that's a great perspective.
Mm-hmm.
Another question that we had come in asked if collagen or other supplements could help the skin or help lupus patients in general. Dr. Ho or Dr. Hernandez?
Sorry, I was typing answers to some of the ones in the chat. Can you repeat that one more time?
Sure. I said, can collagen or other supplements be helpful for the skin, for skin lupus or systemic lupus?
Yeah, I can. So for collagen specifically, or I guess supplements in general, unfortunately, if it were kind of as simple as that, we would be giving them to everybody. The evidence for collagen supplements, especially in lupus, probably is not really there. And even for the more common reason people use them, which would be for like wrinkling and fine lines, I don't think the data is particularly good. Although if someone wanted to try, they do seem very safe. So it could always be worth trying. There was one question earlier about HelioCare, which is a supplement that I'll mention since it's a related topic. So for those of you who haven't heard, HelioCare is basically a fern substance supplement that's kind of sold and studied really for sunburn prevention. And someone had asked, would it be reasonable to use HelioCare in combination with, staying in the shade as much as possible, long sleeve clothing, sunscreen? And I actually think yes. So the evidence for this HelioCare supplement is actually pretty good for reducing sunburns. And we do actually recommend it sometimes for our patients, not just with lupus, but like other sun sensitive and light sensitive disorders that are having really a lot of trouble reducing their flares, even with our like standard treatments. HelioCare is very safe. It's over the counter. You take 1 or 2 pills every day. And we've actually had kind of anecdotally, but some patients come back and tell us like, actually, yes, it was quite helpful. So in the supplement and over the counter world, I think HelioCare is probably the most kind of interesting, exciting, and helpful for patients with lupus.
Great. Wow. I learned something new this evening. That was great information. I was not aware of that.
I'll write the name of it in the chat.
Thank you so much. We appreciate that. And then we have another question.
Just before you jump to the next question, Ashley, real quick, just as a general comment, not specifically related to these supplements, but in general, something I find concerning is the fact that they sometimes delay the patient. So instead of going to the rheumatologist or to the internist or any other physician right away, trying certain things, trial and error consumes vital time. So I would say don't hesitate and seek the help of a specialist for your disease.
Most definitely.
I totally agree with that. If someone wanted to try things like this, I think you should definitely talk with the team that's taking care of you. And something like that is not a replacement for what you're doing, but something to kind of help along with everything else. I 100% agree.
I'll follow up with that. Anything that is suggested to me, I always check with my doctors first to make sure that it's in line with my current treatment and that it won't, interfere with anything that I'm taking. I highly recommend Elta MD, which Dr. Ho display. I use that religiously. It's really helps me out with my skin. And then something that Dr. Hernandez spoke about, I take a vitamin D supplement. I have been since I was 15 because I've been on prednisone and Plaquenil basically as a baseline since then. And I've tried the gamut of all the other sort of medications used for lupus, even the chemotherapies, but consistently for the skin, I have stayed consistent with those supplements and sunscreen and everything that was spoken about today. Just wanted to say that real quick.
Great information. And it's so important to share that with all of your care team, what any supplements you'd like to take. Dr. Hernandez, this is one that you might be able to help address. Someone wanted to know if you could talk more about the type of light bulbs and light fixtures lupus patients should use in their home.
Modern lighting doesn't bring the problems that more older lamps that can still be found in certain old buildings and gyms and other like very like spaces with very high ceiling still can use. Normally, the light that we use at home does not represent such a big risk. However, we have to make sure they are always covered, that the bulb is not exposed or broken. And I think that if we take the necessary precautions by covering all lamps and lights, we should be all right.
Great. Maurissa, the next question's for you. I know that you touched a little bit on this when you were talking about being a teenager and wanting to go out with your friends, but how did you how did the changes in your skin kind of affect your self-image, and how did you deal with that, especially being diagnosed so young?
That's taken a lot of work over the years. It's taken a long time. It was something that definitely plagued me. I was a teenager who was very concerned about vanity. I would spend hours every day covering up my face before school with Dermablend, trying, even though, I'm sure none of my friends were judging me at all. It was just about how it made me feel. It took a very long time to overcome those feelings and understand that what I'm seeing, or that lupus does not define me. It's something that is shaping me and helping me to become the person that I am. I say that now, and that's just something that I learned in retrospect many, many, many years later. But it was hard, admittedly hard. And I don't think until I was into my mid-20s that I finally came to terms about what lupus had done for me and my well-being and who I am. I don't think I would have become a writer had I not been diagnosed with lupus. I went from being a performer person, only relying on my physical abilities, to having to take a step back and understand my limitations. And then I sort of channeled that into my voice and writing. So as much as it has been a challenge for my whole life, it's also been somewhat of a gift. And that's how I choose to see it. Even through all the bad stuff and all the pain and all the times of trauma. And there have been many hospitalizations and all of that. But with each time, the fact that I'm still here and have persevered, I'm just so grateful.
That's such a wonderful perspective to have, and to be able to turn that into something positive in your life. I know that I've seen the comments coming up, so I know that people really are relating to that. So I know that we are short on time, and we have, just time for one last question. And so I'd like to ask this of each of you, and that is, what is the number one piece of advice or tip you would give to someone struggling with skin lupus? And Maurissa, I'll go ahead and I'll start with you.
Listen to your doctors. Go easy on yourself. Try and take moments every day to just be, and moments of peace and quiet, because I do think that lupus activity is very much stress induced and stress related. That's what I have discovered. Take care of your skin, wear your sunscreen, research and follow how you can supplement the medical care with your daily routine, with diet and vitamin supplements and such. But I will say that the top priority is to listen to your doctor's advice and follow the treatments.
Great advice. Thank you. Dr. Ho?
I would say, definitely when there's kind of new spots on your skin, kind of a new rash, not sure what it is, definitely tell your doctors about it right away. I've seen many people who've been like struggling for a very long time and didn't know what they had, and we could have helped them much sooner. So, and if there's, your primary care isn't sure who to refer you to, or if even your local dermatologist isn't totally like comfortable, feel free to ask them if they know someone or can refer you to someone who has experience with this, because we're here to help and we do want to help.
Great advice. Thank you. And last but certainly not least, Dr. Hernandez, one piece of advice or tip for
cigarette smoking. I haven't mentioned that. Avoid smoking, because it can further complicate the disease and its skin manifestations. Be careful with UV light, as we stated at the beginning of this presentation, very important. And don't give up. Just adhere to the medication and to the common sense practices. Be good to yourself, take care, and follow the doctor's orders.
Thank you all so much for answering questions. I know that we've been busy in the Q&A answering questions, and I do apologize if we were not able to get to your question this evening. Please feel free to reach out to the health educators. Again, that website is lupus.org/health-educator, and we will do our best to get you the answers to your questions. So once again, I would like to send a huge thank you to our speakers. Thank you again, Dr. Hernandez, Dr. Ho, and Maurissa for joining us this evening. And thank you to our attendees for tuning in and providing us great questions and listening to this wonderful presentation. If you are attending live or watching the recording, please know that your feedback is highly valued and helps shape our programs. We would like to know what you thought of today's event and hear more about the type of content you'd like to see featured in future programs. Please complete our 10-minute survey. You can access it via the QR code. So you can just hover your camera over that QR code on the screen, or through the link in this slide. I see that the link is not there, but we will also email out the link, and it'll come in a post-event email that you should receive tomorrow. Upon completion of the survey, 5 lucky winners will get a piece of UPF protected clothing from LUV. LUV was founded on a vision to create a safe, fashionable, and sustainable UPF 50+ lifestyle brand. You just need to provide your email at the end of the survey for your chance to win. Thank you so much and have a great evening.